If complications occur, the biggest advantage is that the implanted lens can be removed and your vision can return to its pre-surgery state. Hello, I'm Director Han from iClinic Siblings. Have you heard of lens implantation surgery? Many people have recently become curious about lens implantation and ask a lot of questions about it. Some have only heard of LASIK or LASIK and don't know about lens implantation. And some people come after studying a lot because they want to learn more. So today, I'll help clear up all your questions about lens implantation surgery. Lens implantation surgery literally means inserting a lens. When we think of contact lenses, we think of something placed on the surface of the eye. But this involves inserting a lens inside the eye. Lens position defines surgery type. If it's placed between the cornea and the iris, it's called anterior chamber lens implantation. If it's placed between the iris and the natural lens, it's called posterior chamber lens implantation. For anterior implantation, there's a lens called Artiflex. For posterior implantation, lenses like ICL, IPCL, and MPL are used. ICL is the most representative among them. Personally, the lens I prefer the most is the ICL. ICL is actually the most widely used lens worldwide. So many ophthalmologists overwhelmingly choose ICL over other surgeries. Its safety has been proven over a long period. That's why it allows for more comfortable surgery. The lens material also has excellent biocompatibility. Even after long-term use, endothelial cell counts show its proven safety. That's why I personally prefer ICL. ICL in particular has long used a material called Calamer. It started in the early 1990s, I believe. That's probably when it first began. In Korea, it was approved by the KFDA in the early 2000s. So for 20 years, this material has proven its long-term safety. Because the material itself is stable, it doesn't cause inflammation. There's a model called V4C, and it has a hole in the lens. It's safely designed to allow fluid in the eye to flow without obstruction. That's why the risk of complications is very low. Lens implantation is generally available to anyone over 18 whose vision has stabilized. After the college entrance exam, many students visit eye clinics for LASIK or LASIK to correct myopia or astigmatism. Even those who are not eligible for LASIK or LASIK can get this surgery. If your cornea is very thin, you have severe astigmatism or high myopia. Or if your cornea is slightly too thin, lens implantation is still possible. Honestly, if I could go back to my younger days, I'd want to get lens surgery myself. Even if you have corneal opacity or a genetic disorder like Avellino-corneal dystrophy, lens implantation is still possible. If another clinic tells you LASIK or LASIK isn't an option and you feel discouraged, then it's worth checking whether you're a candidate for lens implantation surgery. Compared to procedures like LASIK or LASIK, a common drawback of lens implantation is its relatively higher cost. But the biggest advantage is that it doesn't involve cutting the cornea. Since the cornea remains intact, the nerves aren't damaged, so dry eye is much less likely. And the recovery time after surgery is very fast. Because the corneal thickness is preserved, retreatment is possible even if myopia or astigmatism returns. If you experience complications like excessive glare or halos after surgery, then the lens can be removed and your vision can return to its original state, a major benefit. Side effects can be a concern because the lenses used in this surgery are expensive. Even though it's costly, in rare cases it can lead to cataracts, glaucoma, or iritis. Iritis is extremely rare and usually linked to individual predispositions or other causes. Cataracts occur in about 1 out of 1,000 cases. With today's advanced diagnostic equipment, choosing the correct lens size for your eye can significantly reduce the risk of cataracts. Glaucoma can also occur in a small number of cases. If intraocular pressure isn't controlled or glaucoma develops, the lens may need to be removed. But if the lens size is accurately matched to your eye, the risk of glaucoma can be greatly reduced, so it's important to choose a skilled and experienced surgeon. If you're thinking about this surgery, I'd love for you to have it done by me. Have your questions about lens implantation been answered today? If you found this video helpful, please like and subscribe. If you still have questions, leave them in the comments. We'll sincerely reply to your comments and give you the answers you need. This has been Director Han from iClinic Siblings.